Good morning or good afternoon. Thank you so much for joining today's session, Equitable Policymaking in Rural Communities, Charting a Path Forward. My name is Pratima Musburger, and I'm the Vice President of Programs at ChangeLab Solutions. We have an amazing panel lined up to talk about rural policymaking. But before we jump in, I wanted to take a quick moment to introduce ChangeLab Solutions. For those who aren't familiar with us, ChangeLab Solutions is a nonpartisan, nonprofit organization that uses the tools of law and policy to advance health equity. We partner with communities across the nation to improve health and opportunity by changing harmful laws, policies, and systems. Our interdisciplinary team works with community organizations, governments, and local institutions to design and implement equitable and practical policy solutions to complex health challenges. Our work is rooted in the belief that laws and policies that have perpetuated racism, discrimination, and segregation throughout our nation's history have had and continue to have a profound effect on health and well-being. So our work is rooted in addressing what we call the fundamental drivers of health inequity. Those drivers include structural discrimination and racism, income inequality, disparities in opportunity, disparities in political power, and governance that limits meaningful participation. We go into much more detail about this framework in our Blueprint for Changemakers, which you can find on the ChangeLab Solutions website. Today's webinar is the fourth and final session in our Equity in Action series. We kicked off this series in January with a conversation about housing justice. We then discussed fair labor practices and how the enforcement of labor laws and policies have the potential to either decrease or exacerbate inequities. And just yesterday, we hosted a discussion about the important role that public health authority and the public health workforce plays in supporting equitable health outcomes. Today, we're wrapping up this series with a focus on policy strategies to support people living in rural communities. We have an amazing panel with us today. So with that, I wanted to thank you again for being here, and I will pass it over to my wonderful colleague, Shaniqua Owusu.
Thank you, Pratima. First, I want to take a moment to go over some logistical notes for today. We are live streaming and recording this event, and it will be posted to the ChangeLab Solutions website. You'll receive an email with the link to the recording once it's ready. If you have questions for our panelists throughout today's session, please submit them through the Q&A box. My colleague Holly Story and Phoebe Gibson will be monitoring incoming questions, and we'll have some time at the end to address them. The chat function for this webinar is also open. We invite you to share comments or reactions along the way and engage with fellow attendees. And we will be live tweeting during this session, and we invite you to join us on social media using the hashtag policymaking4equity. I also want to let everyone know that a live transcription is an option that's available for you today. In your Zoom window, you can see a button that says live transcript, pictured here on the slide. If you click on that, you'll have the option to either show or hide subtitles. You can also adjust the font size to fit your preferences under subtitle settings. Our colleague Bernard Lim is here helping to ensure that all of the tech runs smoothly today. If you run into any issues, you can send him a direct note via Zoom. Okay, I am going to get us started by doing just a little level setting and then get into our panel discussion with our great guests today. So, rural America is not a monolith, but rather a rich mixture of communities, people, cultures, and with a myriad of strengths. 1 in 5 people live in rural communities. It holds 97% of the country's land mass, and its largest industries include government, retail, healthcare, and of course, its mainstays of agriculture and manufacturing. This slide that you see before you here, developed by our friends at the Center for Rural Innovation, underscores the racial diversity in rural communities. 24% of residents identify as Black, Hispanic, or Latino, Native or Asian or multicultural. And rural, Black, Indigenous, and people of color are 21 more times likely to live in a county that's predominantly white compared to people living in metro areas. I am underscoring this point because it can contribute to the narrative of their invisibility in national and local conversations around equity and policy. Also, it's important to note that rural is complex and nuanced. In particular, rural BIPOC residents have endured a disproportionate burden of past policy decisions, resistance, lack of water, undertreated wastewater, limited or no broadband access, limited access to entrepreneur opportunities and jobs. Also, the compounding effect of disinvestment in rural communities and the greater prevalence of higher poverty rates, as well as structural inequities, are most acutely felt by BIPOC folks experiencing persistent poverty in rural spaces. What you see here before you is the Thrive Rural framework. Change Lab Solutions is part of a group of organizations working collaboratively towards a future where communities and Native nations across the rural U.S. and places where each and every person belongs, lives, and thrives with dignity. This effort is called Thrive Rural. The framework that you see here is from our friends at the Aspen Community Solutions Group, and it's a tool to guide action towards rural prosperity. It names the historic and ongoing discrimination based on place, race, and class is the foundation of rural inequity and needs to be addressed at both the local and systems level. And then some considerations for equitable policy development. Some things can include thinking about the impact. So you want to consider rural benefit, racial equity, the magnitude of the impact, and thinking about equitable policy elements. You want to be inclusive of community engagement, optimizing community assets, and also make sure that you have evaluation and monitoring a part of this. In service of this work with Thrive Rural, Change Lab conducted a comprehensive policy span with stakeholder interviews designed to identify high impact, evidence-based state and local policies. We talked to folks in rural health, to local organizers from BIPOC rural communities, state level government staff, and rural development subject matter experts. And I want to leave with you a few themes that surfaced as part of this work in these conversations. While state and local innovation is vital for equitable policy development, administrative barriers do persist and capacity restraints remain a primary issue in rural communities. Capacity building for local government and community leaders can increase technical knowledge, support the development of shared resources, and encourage accountable, transparent investment. And then our historical moment presents an opportunity to advance racial and economic equity in rural places. So with this very short grounding, I'd like to segue into our panelists because they are here today and represent the myriad of change makers within rural communities. And so I'd like to start. We have Dr. Corey Wiggins with us today. He is the co-chairman of the Delta Regional Authority, which is a federal-state collaboration to promote and encourage the economic development of the lower Mississippi River and Alabama Black Belt regions. Dr. Wiggins and his team works to execute the agency's mission through the practical application of innovative ideas and strategies that will foster inclusive communities, strengthen regional collaboration, and productive capacity. A native of Hazelhurst, Mississippi, Dr. Wiggins brings a diverse set of career experiences to the DRA and which has included working in academia, state government, nonprofits, and the private sectors. He has focused his career on creating equitable opportunities through systems and public policy change. Tricia Purdon is the director of the Office of Rural Prosperity, a division of the Kansas State Department of Commerce. Tricia and her team advocate and promote rural Kansas as well as focuses on the efforts designed to aid rural improvements. Through ongoing conversations with rural stakeholders, the Office of Rural Prosperity identifies key policy priorities and blends administrative action with legislative work to remove barriers. A native of Kiowa, Kansas, I hope I pronounced that correctly, Tricia brings over a decade experience to the Office of Rural Prosperity, previously holding rural economic development leadership roles at both the city and county levels. And then we have Rachel Mays. She is the executive director of Southern Echo, a community-based grassroots organization, and leads her team in recruiting, working, and training cadres of new leaders across the state of Mississippi and the Southern region in effective community organizing work. Their strategic goal is to empower and enable local communities to take ownership in building the necessary infrastructure to develop potential leaders who can hold the political, economic, and environmental establishment accountable for the needs of those who are most disenfranchised in the state of Mississippi and across the region. As a native of Florence, Mississippi, Rachel brings more than 25 years of public, private, and government experience to Southern Echo. Welcome, Dr. Wiggins, Tricia, and Rachel.
Thank you.
All right, so we're gonna get started by grounding all of us in the assets and challenges within rural communities. And so I'd like to kick it off with you, Dr. Wiggins. What is the mission of your organization and agency and its key priorities? And from your perspective, what are the key assets of rural communities?
Look, Shaniqua, thank you for moderating this conversation and invitation to sit with and be part of this conversation with some great panelists. Delta Regional Authority is a federal regional commission. There are a number of commissions across the country. The commission that most people or authority most people may be familiar with is the Appalachia Regional Commission, which is our oldest federal regional commission. But you also have the Northern Border Commission, which covers parts of the Northeast, Southeastern Crescent, which covers the Carolinas and Georgia and Florida and Alabama, Southern Mississippi. You have us at DRA, and I'll talk a little bit more about our area. You have Southwestern Commission that covers a part of the Southwest United States, and Denali, which covers all of Alaska. But Delta Regional Authority is a federal agency that's been around about 22 years now. We cover 8 states. Our states includes parts of Alabama, Mississippi, Louisiana, and then going up the Mississippi River. So parts of Western Tennessee, Eastern Arkansas, Western Kentucky, Southern Illinois, Southeastern Missouri. We have 252 counties and parishes in our region. Our structure is unique because of this. While we are a federal agency, our board includes the governors of all the 8 states that we cover. And our governors have designees that we work in collaboration, really focus on economic development. How do you create jobs in the communities that we serve? How do you retain jobs? How do you think about how basic public infrastructure, things like water and sewer and transportation, impact and affect the families? And how do you support training and workforce development for people to be able to get into careers that allow them to support themselves and their families? And that's our grant making. We are a federal agency that does grant making in those areas that I just described. And so when we think about our work, with most of the areas and the regions we cover that's rural, and so not only in terms of the DNA and the focus of our work, where we try to invest our dollars, but for me, this work is very personal. You mentioned in my bio, I'm from Hazelhurst, Mississippi. It's a town of about 3,600 people. And for our participants who are from rural areas, what they understand is that was just the closest town that was near where I actually went to high school at. But I grew up more than 10 miles outside of town. And so when we talk about rural, when we talk about the work of DRA, when we talk about even my personal mission, as we talk about this work, and in terms of assets, the greatest assets is the people. And I think that's what we all know. We recognize rural communities because the expertise of how we do our work, how we align our work, is really rooted in the experiences of people who live in rural communities, is the expertise that they have. I always say people know how they want their communities to look, smell, touch, and taste. It is our job at DRA to support them in creating that environment to create strong, vibrant communities. So again, looking forward to this conversation as we delve into these issues affecting communities across our country, rural communities.
Thank you, Dr. Wiggins, for getting us kicked off here. Trisha, the state of Kansas is one of the early adopters of having an Office of Rural Prosperity. Can you tell us more about that and your take on the greatest assets with rural communities?
Yeah, so our office was established in 2019 when Governor Kelly came into office, and it had been quite some time since the state of Kansas had an Office of Rural or any office dedicated to rural issues. And knowing that we were a state that's 100 of our 105 counties are considered rural counties. We're really excited to see, this office come into be, and we're kind of the point person for every small town across our state. But we also work with other states if they're developing these offices, and really made a lot of strides in making sure that rural communities are getting the attention and work that needs to be focused specifically on them, and the cultures, the challenges, the issues that these communities are facing. I think one of the coolest assets of rural, and I say that growing up in Kiowa, it's hard to pronounce Native American pronunciation. And so Kiowa population 900 in Southwest Kansas. And so knowing that the assets of a community are, that we all work together, this friendly feeling of togetherness, close-knit community that really supports each other. If one member of your town is facing a challenge, the others support them. And this could be an asset. It also could be a challenge, right? And really create some issues with being more welcoming. And so this is something that we tackle regularly in our office of how do we help communities be more welcoming and engaging and equitable, and help folks feel a part of that community and feel empowered to help their community thrive and prosper as they move forward. So that's really the goal of our office in a nutshell. We tackle everything from housing and childcare and healthcare and infrastructure, but all these things, the fundamental thing that comes to all of it is that in order to live in a rural community and people to want to live in a rural community, they want to live in a place where they can make a difference. They can be part of a welcoming and engaged community, and they can provide for their family in a satisfying work environment, in an equitable work environment, and in an equitable community.
Thank you for that, Tricia. So far we've heard connectedness, community, people at the center of that. And so, Rachel, can you tell us a bit more about Southern Echo and your take on the assets of rural communities?
Yes, thank you, Shaniqua, for this opportunity. And I also want to say thank you for changing the date. I think when we first scheduled this call, tornado had just hit Mississippi, and we were trying to support communities and families. So thank you for that. Southern Echo started in 1989 as a nonprofit organization focusing on community organizing in Mississippi and the southern regional states. And so since that time, we have worked in many areas, and we started our work out in redistricting, focused on wanting to have more African Americans in the legislature at local levels. And so we knew that we had to prepare people for the census that then also impacted the redistricting process. And so we've had much success in the areas of redistricting, census, and voting. And our focus is to empower the community through our tool of community organizing with the tools and skills to impact public policy so that they become the architects of public policy and not the objects of public policy. When we think about, or let me say a little bit more about the program areas that we work in. So civic engagement, and so that includes voting, census, and redistricting, public education, health equity, environmental justice. Some people also say that as climate change. And then we have a youth leadership development cohort that we're working with year round to ensure that they are civically minded, but also they are exposed and learn Black history. When we think about the assets of rural communities, we know that I come from Florence, Mississippi, population of about 4,600 people. And there are strong relationships in rural communities. For the most part, the phrase I like to use is that everybody knows everybody. It's a strong network, strong relationships. And, those are the assets that are needed when you're working on different projects or are addressing issues that communities are facing. And it makes for good collective decision making if you're starting at a place where people know people and that there are strong relationships already in existence. The other thing that I would like to lift up is a keen sense of the issues and solutions. It's not a situation where Southern Echo is going in trying to tell community what to do or what issue to focus on. We're supporting them where they want and need support and the issues that they need research around, more information around, empowering them to be at the table and at the microphone to speak their voice around what they want to see given a particular issue or situation. And I'll end with that. Thank you.
Thank you all. So another question I have for you is, what do you think is most often misunderstood about rural communities?
I'll jump in. We hear so much that, rural communities, well, they're dying, the populations are going down. There's not much that they can do to grow or prosper. And that is completely false. We're seeing communities that have turned things around completely by engaging with their residents and showing pride and that their citizens can get involved in making their town what they want it to be. I worked at this town, Matfield Green, that was a population, 40, 50 people, and now they're up to 90 because they've identified themselves as this arts hub in the center of Flint Hills where artists, musicians can come and see the sunsets and the wide open prairie with no light pollution and be inspired to create new art. And their population is growing every single day. They've turned homes that were falling in into beautiful Airbnbs for visitors and artists to stay in. And permanent residents have turned around old schools and turned into recording studios and old banks into art studios. And you can see when people are empowered to be a part of their town, they're not dying. They're not, the population doesn't go down. They can turn it around very quickly if they get engaged.
Just want to.
Yeah,
Can you hear me? Okay, my internet keeps going in and out. I apologize. When it comes to rural communities being misunderstood, it's the fact that communities, many people say communities don't want progressive change or that they don't want better living conditions. And, I don't agree with that at all, or that they don't want quality health care. They don't want healthy foods. It's the situation that communities find themselves in. And I see it as our role to support communities where they are, hear where they are, listen to their concerns, and then help them build a pathway out of the situation and out of the place that they find themselves in. At the end of the day, rural communities matter. It's important that their needs are addressed, that their voice is valued, and that their opinions are heard. We have to move from the point that we are not characterizing rural communities by their unique challenges, but rather collaborating with them to share what possibilities, right? And build out from an asset mind frame so that communities in the rural areas can realize a full and thriving life, just as communities in urban areas.
Hey, Shaniqua, I saw when you asked that question, I was looking at the faces of my panelists, and I saw Tricia sort of look up to the left. And I wonder if she was thinking that her initial thought was something that came to my head, was just in that question itself, right? This question of what's misunderstood. And for somebody who grew up in this in a rural community in Mississippi, it's like, well, it's an interesting question. And I say that because my understanding of rural is nothing that's misunderstood about it, right? There is nothing, any place that you live in, urban, rural, suburban, wherever, it's going to have is unique opportunities and unique challenges. And so there's nothing, different or misunderstood about that. I think what happens though is that some people, depending on their experiences and frame to work, take rural communities for granted. Right. I think that's what the piece that starts to emerge for me, because the people that I know, whether I am visiting communities in Western Kentucky, Southern Illinois, the Alabama Black Belt, and Mississippi Delta, regardless of even the demographics, or racial demographics of the places that I visit, what I tend to meet and what I understand is meeting good people who bought into this culture or have a culture or a sense of community of figuring out how do we take what we have, leverage what we have, and create a community that everybody can enjoy. And particularly with the context of people thinking about, particularly when I engage with a lot of our elders and people who are living in rural communities, are thinking about how do I continue to make our community vibrant so young people will live there, so people will not move out, so people will raise their families, right? And so these are the things that people are thinking about. I think sometimes people take for granted rural communities in the sense of the brain power, the thought power, the sheer will, the determination, all the things that it takes to create vibrant communities, all of that exists in rural communities. And my experiences in traveling around the DRA region is everybody is working hard each and every day, trying to do that, working towards that. And even as they're doing it, yes, there are some challenges that exist. There are supports that people need in trying to execute on that. They are not asking people to come in and tell them what to do, but they're willing to work with people who are listening to them and helping them execute on the plan that they want to see happen in their community. So I just, that question as I think about it is like, well, no, it's not anything that's misunderstood. It's just some folks, depending on your experiences, may take for granted the experiences that people have in rural communities.
Thank you for that. And so much of what has been said thus far is so deeply resonating for me. Fun fact, I'll say, though urban native, I grew up in a rural community of 400 people. And so it's very visceral, this conversation. And I'm also reflecting on a statement that was said all the time, which is come as you are. So now I'm really just gonna come as I am. Trisha, I'm very curious. When you looked up, how did that, did what Corey say here, resonate with you?
Yeah, absolutely. I was just like, yes, I hear that all the time. And it's frustrating. And like Corey said, yeah, world knows what it is, right? We know, we're from these small towns and we're fighting every day to do it. And as someone in Western Gibbs, we're fine. We know what we want to do. Yeah, it'd be great if you guys could throw us a bone and send some money this way now and then, but we don't need you to come in and tell us what to do or how to do it. But if you can give us some guidance. So, by the way, here's how another town like yours did this thing, and you have this problem, and how we can move forward. That's what we're saying. Just a little bit of assistance of brainstorming and support and listening. Yeah, it all resonated. Thank you, Rachel, for your comments too. Yeah, it just really struck me. I married a man that's from Kansas City, and we moved to a rural area. And I had to, tell him, I understand that you said you're from northern Johnson County, and so it's the small part of the city. It's very different. But you learn to be self-dependent and reliant on your neighbors and your friends. And that sense of community is really important.
I'm starting to hear lots of action words, and I might transition us there. Before I do, if there was something that you could emphasize about rural equity, what might that be? And I think we heard a little bit of that with Rachel letting us know folks need to be the architect of public policy, not the object.
Yeah, I'll jump in. And one of the things, so my training and background is in public health. And what I think what helps and supports me in this work and thinking about this work that we do in economic development is that, when you say things like, and I know we have public health and healthcare folks on this panel and on the attendees. So when I say words like community-based participatory research, right, that doesn't it's big words, but it doesn't scare folks because what we're talking about, and Rachel talked about the work of Southern Echo is organizing. What we're talking about is organizing. And there's a sense of organizing. And I talk about the SNCC model of organizing, where you actually live in and be in partnership and in unison with community. And you engage in community and you are there to listen and support the vision that people want to have and the vision that they have for community. And so sometimes when we hear the word equity by itself, right, whether you're talking about rural equity or urban equity or equity in general, equity is not a one-off thing. It is not a thing that you go and do. It's not a thing that an organization writes down in their mission statement and add in the word equity. And now we're saying, oh, we're equitable. Equity is also based in a process of inclusion, a process of sharing and giving power, a process of acknowledging your own power in balanced dynamics, a process of moving towards to level, right, that power. And sometimes in leveling that power, it requires to give power away, right, or to stand back and let another community, entity, or agencies or their own agencies stand out. Right. And so it's just this thing about, and so when I think about in the context in rural, I think the same applies to whether you're talking about equity in general, equity in an urban context, about the process in which you engage, how you engage, and how do you have, from our side, grant making programs that are designed in a way with the end user in mind, whoever the end user be, rural communities in our sense. And so I think for me, rural equity brings into these things of re-examining process and processes to determine if they're working. And if they are working, who do they limit, who do they exclude, and how do you redesign in a way that is done in a more inclusive way?
In this moment that we're building back, right, from tornadoes, from COVID, from, falling bridges or crumbling bridges. So that's infrastructure. In Jackson, we're dealing with the water issue. How do we embody the concept of social determinants of health and also robust equity? And that's coming from the wholeness of an individual and that person's well-being. Realizing that for one person to truly thrive, you must consider their civic life. You must consider their health, transportation, jobs, environmental issues that may impact that person, education for that individual. So we can no longer just segment what does it take for a person to really thrive. When we're thinking about policy and we're thinking about equity, we have to think about it in a way that impacts a person's well-being. And that's the full, or what we call whole person, not just, we got to make sure we give that person a good education, or we got to make sure that that person is connected to good health care. It matters that we connect people and we support people from a perspective of wholeness and well-being. And that means that we're concerned about that person, about the wholeness of that person and them thriving in a whole way.
Thank you for that, Rachel. Trisha, get in there.
Yeah, I would just say like that. Exactly, Rachel. I mean, you have to look at it. It's not the chicken or the egg, right? You have to look at the individuals and how you're addressing what they need to be a successful, prosperous, kind, amazing person that will contribute to society in the best possible way, right? In order to help them have great healthcare, childcare, housing, education, opportunities for workforce development, all those things. You have to look at that whole picture, at least coming from the state perspective. You know, how can we help, you know, a new resident, an immigrant, you know, a refugee that has moved to a rural community feel engaged and welcome in that town, but also the 85-year-old person who, like Dr. Wiggins said, you know, has that history and that tie to that town, what that was, and merge the two so they all feel welcome and engaged and part of the town and have the opportunity to prosper and grow with a way that everyone can be a part of it. And that's the work that has to be done to address equity. It's every direction.
And I think the other piece I want to lift up is that, and I heard Trisha and Dr. Wiggins both lift this up, we have to include the voices of both youth and our seniors, right? And not exclude either one of those, because, you know, there's so much history and legacy that seniors can provide to whatever issue we're facing, because they've already lived this life, right? To a certain degree. And then the youth, there's so much technology that is coming out every day, and youth are quicker to understand, to navigate, to process, to engage in all of the different things that are out there as it relates to technology. And so in building out all of our dreams and vision around equity and what rural America can realize, urban America can realize, we must be cautious, right, and intentional, including both youth voices and senior voices.
Thank you for that. So I'm hearing there's some themes popping up that some might put into the category of like polarities, but they're not. Old and new, right? Technology, legacy, interconnectedness, whole. And so this leads me to another question for you all in the spirit of like moving action forward. At the regional, state, and local levels, what strategies and policies do you see being implemented to advance economics, health, racial equity for those living in rural communities? And then a second part to that question to hold is to the connectedness part. What can be done to improve the coordination between regional, state, and local agencies?
So when COVID hit, many of our rural communities did not have Wi-Fi. And so that's one of the things that is happening in Mississippi. Many of the areas in the rural communities are receiving Wi-Fi. And, you know, it's not just for schools that we need Wi-Fi in rural communities, but with more and more hospitals closing, it is a way for some people to receive health care through telehealth or through, I can't remember the proper name for the web-based interaction as it relates to healthcare. But it's becoming a part of our life. And for rural America or rural Mississippi not to have what it needs in the way of Wi-Fi, it certainly showed its face when COVID hit Mississippi. And on the flip side of that, what are the things that we can do to help support progressive policy or practices or equity in general? To me, that is having town hall meetings, having meetings with local officials. And those meetings are from people within the rural communities, having conversations with policymakers, board of supervisors, mayors, city council persons, to share with them what they want to see in the way of progress as it relates to things that they don't have, that they should have. And so it's just elevating the conversation from just maybe a kitchen table conversation or from a community meeting to actually talking to the school board, to actually talking to board of supervisors. And it does not have to be at the board of supervisors meeting. We have to start, if we haven't already been doing that, we have to invite those people to the community, right? To have those critical conversations. So it takes action from the community side to organize and then be willing to go have those conversations. And then it also takes action from holding the elected officials accountable and inviting them to our community to have conversations about what we want to see that we do not already see.
Yeah, I'll jump in. And, so to that question about moving towards action and even thinking about the work that we've been doing at DRA across our region. As I mentioned, we are a grant making agency. So many of the things that people or communities are thinking about that they want to do. And I think Tricia pointed this out, you need resources. What we have seen in the body administration, the commitment in the administration is more money available, more resources available for infrastructure funding. Our agency is a small federal agency, but we end up receiving an additional $150 million through the bipartisan infrastructure law in our agency to do grant making across the region. Our annual budget had been about $30 million. So we were doing about $24 million in grants across our region. This past year, because of the influx of the federal dollars, we've been able to we did about almost $70 million in grants. And our funding portfolio is diverse and vast, right? We fund everything again from water and sewer. I know Rachel mentioned the challenges that the city of Jackson is facing around water. What I've shared across our region is that Jackson is a city that everybody across the country has seen on television. There are plenty of Jacksons across our region that we just have not seen on television. And so how do you make sure that you have money available to support people having good, clean drinking water, wastewater systems that work, having quality transportation that allows for, economic development? How do you make sure you're training a workforce to take advantage of and recruit new jobs? Ensuring that our community college systems, our four-year universities, our HBCUs, and other minority serving institutions have the resources to train tomorrow's workforce. And so one of the ways that we've gone about doing it is that we, coming into right after my confirmation, I came in, we did a listening tour across our region. What we learned in that process is that everybody on the ground in rural communities are hearing about a lot more resources. Federal dollars are flowing. But that works for you, and you can take advantage of that if you have a machine already in place. When I say a machine, meaning that you have an economic development supportive team operating in your city or county or parish that is used to taking advantage and getting federal grants. If you do not have that, if you are from a community like I grew up in, where there was a part-time mayor, part-time alderman, a city clerk, and that was your machine, that's all you had. It is very challenging. It can be challenging to take advantage of opportunities. So what we did at DRA, we went back, and we're still in the process of doing some of this. One is our strategic plan, in addition to being able to do workforce systems, public infrastructure, small business development, we added a fourth pillar, which was capacity building. So communities need support to be in position to take advantage of the resources that's available. We invested money making capacity building or strategic plan grants available to public bodies in our region to help them position their community, their agency to take advantage of not only resources from DRA, but other federal agencies like Department of Transportation, Department of Energy, Economic Development Administration. Because sometimes your first application, if you're a part-time mayor, may not be the best. You may not have all what you need to put together a strong app. Sometimes you may need a little bit more planning, but what we have to do is support you in your capacity, provide technical assistance to position you to bring back home your taxpayer dollars, because they're not just for communities who have the economic development machine. No, they are for all communities across our region, rural and urban. It's just to that equity conversation is that sometimes we got to invest more in some places to have them better positioned to take advantage of the resources that was rightfully theirs and is rightfully all of ours, because these are dollars that are coming back, returning back to communities to help support vibrant communities. So from that action piece, those are just some things, at least organizationally as a federal agency, that we are doing and have been doing to make ourselves more accessible, to make communities so that communities see themselves in the agency. And it's the little things. And I'll close with this, just an example. You know, if you are a small town, a community, we hear this often, and you particularly hear this often in underserved communities. Well, why should I apply for that grant? I never get funded anyway, right? I don't think that is attainable for me, right? So we, as an agency, have to take ownership of that, right? Examine our data, look what has happened, right? Make sure we got systems that work, that's accessible folk. But it's also on us to go to places and talk to people. Like, we can't sit up in the ivory tower. We can't sit up in the office. Like, we actually go up and show up in the communities that we're serving. And even to that point, communications matter. So when we're putting out communications, rural communities need to see themselves in what we're producing and coming out, because they know, like, oh, they're thinking about us. So those are the kinds of things that people pay attention to, not only just what you're talking about and what we're saying, but showing a picture that's inclusive and then actually putting your money where your mouth is. And that's part of the action and some of the work that we're finding ourselves that we're having to do at DRA as well.
Yeah, I think you're right on point there, Corey. We quickly saw that, one, capacity, right? These rural communities, they don't know how to apply for some of these large federal programs. I think I had seen a question in the chat very early on. These programs are hard. They're hard to apply for, and you've never done this before. And I've had several small towns come to me and say, well, I just feel like I'm in one of those, those carnival money machines where the wind is just whipping it around you as fast as you can. You just can't seem to grab it out of the air and stick it in the hole so you can come out with the prize at the end. There's always opportunities, but there's not capacity to grow it. We tackled that kind of a multi-pronged approach here, but looked at it, one, just doing basic trainings on how to go after economic development opportunities, how to address housing, how to address childcare. We created a program called the Grassroots PD 101 and 201, and we charge like $30, and you can get a group of people. Was it your board? It was your chamber. It was your economic development show folks. It was your city and county commissioners, whoever needed to be in that room for $30. But they could just watch. And honestly, $30 just covered the Zoom account. And now it's free. It's all on our website. You can log in and watch any of these videos. And I think we ended up doing almost 20 of them over a period of a year, so that people can learn how to do this and they can take it in snippets. Okay, here's how we're going to apply to rehab some buildings in our downtown so that we can get some new businesses in town. Or here's how we can address some healthcare shortages and how a community similar to ours was able to address when they lost their hospital and how they're able to fill that gap. What were the strategies that they did? And then we spun that into a new program we called the Champions, World Champions, where we're funding 12 individuals to tackle the one big challenge that their community identified in their strategic plan, like you mentioned, or community engagement or town hall. This one thing is the thing that's holding us back. If we just had someone dedicated solely to this one thing for a solid year, and this is all they did, we could finally move forward. And so we surround that champion over this period of the year with every resource that we can find to surround them. And at the end of that, we'll fund that project or the portion of that project. Some of these projects are enormous. But what we're trying to see is that growing the capacity of these rural communities by not just putting it on one person, but showing that you have to do it as a collaborative team, putting together philanthropy, community foundations across the state need to be involved in economic development and the city development and county development, community development. You have to have regional foundations and regional planning organizations as part of that conversation. But that builds upon itself, right? So it's not just this one individual that's gaining this capacity to watch this webinar, but it's now that board hears what they're trying to do. Now that chamber hears what they're trying to do. Now that foundation, now that regional planning group. And suddenly an entire region is having the same conversation, using the same language, and they can work together to now, okay, we've been able to do this on a local level. Now we can start going after some of these federal programs because we understand this. And we've created this team that works collaboratively together. And so it's all being on one person, that person burning out and then they leave. And then you're back at square one again. And that's the strategy we've kind of taken in Kansas. It's just, you can't put it on one person. It can't be, we have 105 county economic development individuals. These 105 people are the ones who are going to make Kansas move forward. That's not even close to feasible or reality. Because you lose one cog in that wheel and the whole thing falls apart. So building upon that capacity, building upon relationships of different organizations that maybe are not at the table, and making sure they're at the table so that they can all learn together to move things forward.
Thank you for that. I'm really appreciating in this conversation what's being surfaced is the how. So often when we talk about policy development or what policies, it's like this list of policies X, right? Might, could, do, Y. But rather here it's the how, the illustrating of that, the illustration of systems, partnership, connectedness, and then really digging into the roots of some of these challenges. In this case, there's been a huge theme around capacity building, the need for that, and how you all are doing that in various different ways. To push just a little deeper into some interventions, Tricia, I'm curious if you could touch a little bit on the rural opportunity zones in Kansas, as well as the IDA accounts and NWBE supports. I think that might help some of our audience members draw that through line to some policies.
Yeah, absolutely. So the Rural Opportunity Zone program was a program that was established in 2012. The goal of this is to, again, bring more than one group together to recruit individuals and show people that we want them in rural Kansas. So we fund up to $15,000 of student loans to pay off student loans. And that can be sponsored by an employer, by a foundation, your city or your county, to show that, hey, we want you here and you matter. The organization puts in a bit and we put in a bit so that they have some skin in the game. They also provide a 5-year personal state income tax exemption or credit for 5 years if you move from outside the state of Kansas to a rural community. And we've been doing that since 2012. And on average, we have about 300 to 500 people in a year that take advantage of just the student loan forgiveness portion. But we're really focusing in on, you need nurses, you need builders, you need electricians. But let's help them really focus in on those critical needs they have for that town. Then the IDA is a program that we created, was created at Kansas Department of Commerce that helps individuals create savings accounts, basically. And again, by working with their foundations, their community development organizations to sell tax credits, and then individuals can then apply and have money set aside in a savings account that will pay for starting a small business, higher education, or buying their first home. So these funds are just ready for individuals that are low income and get these tax credits or the cash from the tax credits so that they can actually set aside some money to make improvements to help themselves prosper. And then lastly, the Women and Minority Business and Entrepreneurship division of Kansas Department of Commerce really focuses in on one-on-one supports, kind of that resource building of peer-to-peer mentorships to support women and minority business owners as they grow. I would say Kansas is unique in that we have the program Network Kansas that provides low interest loans so that small businesses, especially women and minority owned businesses, can get a much more attractive interest rate, terms, everything that a bank can loan. To really make sure we're drilling down into those businesses that we want to see prosper in the state of Kansas. We are not competing against the banks, but we are providing that gap financing where a bank normally would say, well, we need you to see 20% down. We're going to come in and say, you can fund up to 45% of your loan with this very low interest program, which far will exceed what that bank's going to require you to do with 20% down, which makes them more likely to lend to them too. So it really creates this partnership on a local individual entrepreneur level, and then pairing it into new businesses. And then they want to hire employees and they can use the ROS programs. These all kind of build upon each other and support each other to help individuals achieve prosperity in a rural community. And I want to clarify, so the ROS program is specific to Kansas. So this is not the federal opportunity zone program. This is just Kansas. And we were here first. Our program existed first. But this is specifically, it's 95 of our 105 counties that are considered very rural areas, a population 40,000 or less county that are eligible for this program.
Thank you for clarifying that, Tricia. And I think that's a really important point that's undergirding that too, that oftentimes at the federal level, feds look to the state and local level to see those innovations and what's promising and what could work. Hence, like the laboratories of democracy, if you will. Rachel, I wanted to ask you, what are some of the policy campaigns that Southern Echo has been focused on? You've named a whole wider range of different focus areas as per the social determinants of health, but is there one you would want to highlight here today?
Yeah, so we're focusing on whole child equity, right? And adolescent learning and development. There's been a lot of work around pre-K, making sure that, students pass a third grade gate test and all of that. But what we found is that maybe after 5th or 6th grade, the attention sloughs off. And so there's not a lot of attention from 7th grade all the way to 12th grade. And when we think about the promises of the future, then I see that as being the youth. But then the question becomes, how are we preparing youth, right, to think in an equity framework, to think about or to be prepared for career or college, whatever they choose? How are we preparing them to be civically minded? And so the work that we're doing in the way of adolescent youth envelopes all of those things that I lift up, but it also embraces the family and the community. So yes, it is about adolescents, but what is the community that adolescent lives in? What are the supports that community or the school needs to thrive so that student also thrives and not just go through 12th grade, but there's a plan for that student to thrive in each grade so that they're successful and they see the value in being prepared to make choices that lifts up equity for not just themselves, but for all people within the community.
Thank you for that. So I know that our awesome audience has some questions, and I want to make sure we can get some of those in there. And to tie into that, to close this section out, I wanted to ask you all sort of in a rapid fire way, as we are dwindling on our time. Such an engaging conversation. I could keep going. Thinking about the future, what makes you hopeful, excited? What are those opportunities that you're seeing? Who wants to jump in there first?
I'll jump in. We're seeing communities that are more empowered, are more engaged, are very active in the policy making of not just their town, but at the state level and federal level. When we first started doing our listening tours in 2019, maybe get 30 or 40 people show up to one of our listening sessions that we did. Now we host a webinar and there's 500 or 600 people who participate in the state of Kansas. We do conferences and they sell out in a day. We are seeing more people, and it's not just one person, it's the whole community working together to get engaged and get active to address some of these needs. And we're seeing those towns that are doing that turn things around. Populations are growing. It's unfortunate that the census happened in the middle of the pandemic. I would love to see what it looks like, at that midpoint, because I think we're going to see a transition. They don't feel like they've been left behind. They feel very engaged and active in a way that I haven't ever seen before. And I live in the state most of my life.
I guess this idea of the practice of collaboration is something that I'm hopeful of, and I'm seeing this more and more, and I can speak to it from a federal framework. One example is under the USDA, they have the Rural Partners Network that is operating in communities and rural communities across the country, where they are bringing a cohort of rural communities together and bringing a whole of government approach to support communities in thinking about how do they support their vibrant, and I say vibrant communities because it's not just in the context of thinking about economic development and job creation, right? But it's also thinking about how do you create opportunities and resources to support strong schools, strong rural healthcare systems. At DRA, we operate a program for struggling rural hospital systems across our region, whether we support them with technical assistance through HRSA to help them get back to positive cash flow, but thinking about how do you support the systems approach. Something that we are involved in now, DRA is actually leading, I know Rachel mentioned the tornadoes in Mississippi. 2 months, or really probably about a month or two prior to the tornadoes in Mississippi, Selma, Alabama was hit with a devastating tornado that crippled the housing in the city, a lot of businesses. And so even in Selma right now, Delta Regional Authority, we're leading an interagency task force consisting of Department of Transportation, USDA, HUD, all of our federal agency, in thinking about how do you support, not only there's the initial response process that you respond to a disaster, but how do you take this tragedy and thinking about it as a rebuilding and rebirthing moment for communities, particularly when you think about rural communities. How do you think about the design work? How do you support infrastructure development that produces healthy, designed communities? Getting investments in there, rethinking how do you support economic growth. So I think the spirit of collaboration so often that sort of me, and it just real quick, I'm sitting in this space of government, but I've been in the space of being a former college professor. I used to be executive director for the NAACP, one of the state NAACPs. And so with those different hats on, I can't necessarily take them off. I think about this work and what we do, but so often people have held government accountable and have tried to hold them accountable, particularly through a collaborative model, right? In listening, responding in community, but now I'm sort of seeing government or federal government thinking about how do we bring the whole of government to think about and to invest not just thinking, but put money into communities and helping whole communities. To that point, Rachel was talking about whole children. Whole children need to be supported by whole communities. And so whole communities can be created or influenced by investment of money into all those aspects of whole communities. So the spirit of collaboration is something that has me. Philanthropy is involved, CDFIs are involved, private equity, all these things sort of at this table and thinking about collaborative investments.
So what's exciting, or what's the bright spot in the work that we do? I would say it's the work that we do with youth. We have a program called Youth Empowerment for Scholars, YES. And that program brings in youth from rural parts of the state, and we expose them to STEM careers. But we also introduce them to drones, take them through an airplane assimilation. We take them to NASA science centers across the state and out of state. So we're getting ready for that next week at Jackson State, and the engineering department will be there for a week. But to know that, our future lies in their hand, how are we helping them to prepare for that future? And to see them at work, being able to ask the questions that maybe they don't ask in the classroom, but also provide them with exposure that some of the rural, maybe science labs are not outfitted, right, in the way that they should be outfitted, but they're not outfitted. But Southern Echo is exposing and sharing with them knowledge beyond the classroom so that they are ready for work and career and to be civically minded.
Thank you so much. All right, so I've seen all of the activity in the chat, and I'm so glad, audience members, that you've been throwing out your comments and reflections and also engaging with each other. I am going to put forth a couple of questions that we have in the box. And the first one, and we have touched on some of the questions that folks asked earlier on, I believe. Dr. Wiggins, we do have a question regarding the humility-based participatory research concept. If you could share more about that. And I think folks are looking for a little bit more in the SNCC approach to organizing. I think that would be helpful.
Yeah, well, it's communities, CBPR, community-based participatory research, and it's a model that's used in public health research. But, when I think about the common sense approach to it, it is the ability to sit down at a table with the group or groups that you're working with and be in relationship and conversation with them and to actively negotiate towards the desired outcome that you're working towards. And when I talk about SNCC, Student Nonviolent Coordinating Committee, and Rachel can talk about that all day with their foundings and early beginnings at Southern Echo. But, when people think about organizing, when we think about civil rights movement work and the different figures, right? You had Martin Luther King, Fannie Lou Hamer, Medgar Evers, all these different folks who did organizing. Organizing was done differently based on the organization. And all it is everybody got different approaches to work, given community. I appreciate the organizing model, an organizing model that was based in community, right? Based in local relationships. There's this great book about organizing in Mississippi called Local People that talks about organizing in Mississippi. And this basis is really, really leaning into local people who saw injustices and worked to right them, right? And it was trained and untrained, skilled and unskilled, but they were human who saw injustices and wanted to see them shift and change. And so to that point, when I think about our work collectively, is that we know the challenges. Everybody talks about all the challenges that exist in rural areas and communities. The research is done to be research. And I say that as a former researcher. But how do we move towards solutions? How do we show up in community and saying, hey, I don't want to study you. I want to work with you towards solutions. And so I think both thinking about organizing thinking about a community-based participatory research or a community-based participatory model is about working with people towards solutions.
Thank you, Dr. Wiggins. So as we approach our last 4 or 5 minutes of our time together, and I'll take 1 minute at the end to close us out, I will present one other question. Rachel touched a bit on this with respect to telehealth, but we haven't talked too much about the healthcare infrastructure, which is why I'm raising up this question. And here it is from one of our attendees. Most rural communities do not now, nor will they have anytime soon, enough revenue to do much with the health system development. The question is, who should be paying for developing rural infrastructure if rural jurisdictions cannot? Any thoughts from our panelists on that?
Well, I'll say this. I mean, as an agency here, I mentioned, so we do healthcare work at DRA. Like I mentioned, our partnership work we do with HRSA with struggling rural healthcare systems. But then on the other side, from our grant making, hospitals and public schools in rural communities tend to be your employers. That tends to be where a lot of people work. And so that's why I mentioned you got good, strong schools. That means you have good, strong jobs and good, strong children, right? If you got a good, strong hospital, you got good, strong jobs. And that's just how rural communities are designed. And so we actually do grant making around healthcare institutions, particularly when you get into infrastructure, because if you build a hospital, you create jobs, right? And so to that point around who's paying for it, there are a number of different, whether state or federal programs available to support rural healthcare infrastructure. We do this type of work at DRA. We also operate a J-1 visa program at DRA that works to try to bring and provide J-1 visas for health physician shortage areas. And so I would say take a look at DRA, other federal regional commissions who's doing this work. USDA Rural Development builds and does a lot of work around hospital systems. Yeah, the Federal Office of Rural Health Policy. So you have these agencies there. And if it's helpful, Shaniqua, we can follow up with more information. It may be helpful for folks to have that information of the different federal agencies who operate in this space.
Thank you for that. So folks, we are at time. It's all that we have for today. There are a number of questions in the Q&A box that we won't be able to get to. However, we can follow up with responses for those questions. And so I want to extend a huge thank you to Dr. Wiggins, Tricia, and Rachel for sharing your insights. And thanks for all of you for tuning in for the discussion. Dana, if we could pop up the slide on resources. We've got some new resources today, actually. We have our new Equitable Development resource that is out, as well as States in Action. So those are quick state case studies. Kansas is featured in that. And we also have a pretty good blog series that touches upon things like housing and broadband and etc. Also, before we close, please note that we'll be posting the link to this recording along with a summary of this conversation and any key resources mentioned on this website. I also want to emphasize that DRA, the Office of Rural Prosperity, and Southern Echo also have amazing resources on their sites as well. And then lastly, here's our contact information. Stay connected. Thank you so much for your time today and enjoy the rest of your Wednesday, I believe. Take good care, everyone.